Welcome to Cosmetic Innovations. Thank you for joining us. Every week we want to bring you interesting stories and ideas all about looking and feeling your best. But first we're going to be talking about a story that has to do with my own personal challenge, looking 10 years younger by the end of this series. I spoke to Dr. Adibfar recently, who's a cosmetic plastic surgeon, and although we won't be doing any surgery, we talked about something called non-surgical facial rejuvenation. And that's where our first story begins.
Okay, I'm excited.
So we're going to be talking today about what options I have that are non-surgical in terms of working towards my goal of looking 10 years younger. So what can we start off with?
Well, let me start off with a mirror here. Why don't you take a look in the mirror and tell me what's bothering you, and then let's come down with a plan, see what we can do for you.
Okay,
so
I like it.
What's bothering you?
All right, so my eyes, right? This area right here, they're a little droopy. I've got these lines here. I don't like that. They're looking older. Second, these lines right here, these divots in my face. I've actually had these since I was a kid. It's just sort of genetic. And one seems a little off center.
The left side is more prominent. Yeah.
And then the third thing that bothers, see that? I hate that. The neck muscle that's prominent. I don't know if you can do anything about that, but yeah, those are the three areas.
Great. So let's take a look at it here.
Okay.
So essentially what I recommend, I think your eyebrows have descended a little bit over time. So I think just putting a little Botox in your frown muscles and creating a little bit of a brow lift, that's really going to open up your eyes and more youthful there.
Oh, that'd be perfect.
And some Botox in your crow's feet, which is going to work on your squint muscle, is going to work very well and smooth out that area as well. It's going to go through a tiny little needle and no mosquito bites.
Yep, I've had it done here before. I loved it. Yeah.
And working our way down here for this deep grooves in that area, I think the best, since you don't want to have a surgical treatment, then the only thing I can really recommend non-surgical for you would be fillers.
A filler.
And the filler that I recommend in that area is called Perlane, which is in the hyaluronic acid family, in the Restylane family.
Right.
And it works quite well and would last up to 8 to 12 months for you.
Great.
As far as your neck, it's really not that advanced. Your neck bandings in here are not that advanced, but I suggest we should try some Botox there, see how it works. It's basically hyaluronic acid, which is a sugar molecule under the microscope, and basically draws water towards it, right? That's what sugar does. And it stays there. It's not a protein. It doesn't come from a cow. There's no chance of allergic reaction to this product. And it's quite inert, and your body gradually eats it up.
So again, with the Botox, it relaxes the muscle itself.
Exactly. That's what it does. It relaxes the muscle. And basically by relaxing the muscle, as a consequence of that, it softens up your frown lines and also helps elevate your eyebrows as well. All right. So anything else I can do for you?
I think we've got it all looked after. My face looks funny because it's still swollen.
Exactly.
And I'm still a little frozen. I'm all frozen. So this is not what the end result is. Let's just make that really clear. So thank you very much.